everyone, this is Dr. Patel coming to you live from Orlando, Florida. And today's topic I wanted to discuss was what is female pelvic organ prolapse and exactly why it happens and what you can do about it. And first off, I wanted to apologize about not being able to do the live yesterday. I was having a little bit of technical difficulties and I had to kind of get that all sorted away earlier today, which is why a little behind schedule than normal. Facebook Lives will remain every Tuesday and Thursday moving forward at noon Eastern Standard Time. But with that being said, getting back to our topic, pelvic organ prolapse. That's basically when the woman's pelvic floor muscles, which are like a bowl, and they support all of the structures inside her pelvis, such as the uterus, the ovaries, the fallopian tube, your bladder, all of your intestines, your colon, and rectum. There's a lot in there. And in order to support all of that from just sliding out from your pelvic bone, your muscles create almost like a floor of your pelvis, comparable to that of a house. And if you were to have any kind of compromise in that pelvic floor or in those muscles, then the structures will start to sag down, kind of like when a canopy is filled with water and it starts to weigh down on itself. And the consequence of that is that it can cause a lot of discomfort, a lot of pressure. It can functionally limit a woman from doing activities that she normally likes to engage in, such as running, jumping, doing aggressive exercise. Even sometimes light exercise can be prohibited by the feeling of things coming down or sliding out even. And the reason why these muscles typically get compromised is, or at least the most common reason, is childbearing. So when a woman is pregnant and that uterus grows from being about the size of my fist, it looks a lot bigger here, but the size of my fist to actually almost the size of a watermelon, that weight and that that stretch in your pelvis causes the muscles that are housing the floor, that are housing the all of your organs, to also stretch to accommodate. And otherwise it would be, and it already is, really uncomfortable when you are pregnant and the pregnancy is growing. But if that flexibility wasn't there, it would be even more intensely uncomfortable. And so in order to accommodate for that growing pregnancy, these muscles stretch out, they become thinner, weaker, and they allow for the uterus to sit lower as the pregnancy grows farther and farther. And 9 months of this, and these muscles can have a hard time going back to where they used to be. Even with exercise and physical therapy, it's very difficult to get them back to the way they were before baby. Another thing that can actually induce pelvic organ prolapse is simply just aging. Just like our skin tends to go down, our facial muscles tend to sag, our skin tends to sag elsewhere, our muscles in our pelvis also can just become compromised from sheer time. Other things that can also induce that, if you have any kind of a condition, a medical condition that causes a lot of strain on your abdominal muscles. So in other words, if you have something that makes you cough chronically, people who have chronic obstructive pulmonary disease, who are affected with coughing a lot, or people who are actually, when they do a lot of strenuous exercise that includes a lot of core bearing down, you are, even though you're strengthening your core by doing some of these exercises, if you are not countering with keeping your pelvic muscles tight, you can actually compromise them because the pressure in your abdomen outweighs the pressure in your pelvis, and it causes them to also stretch and sag. And again, this is not as extreme as the impact of childbearing or the impact of aging, but that can contribute to that as well. So these muscles, there's usually about 3 or 4 major muscles that make up the pelvic floor, and they support the uterus, the bladder, the rectum. And those are the 3 main things that can tend to start sliding down. And the way a woman will actually notice that is that it will be the top of the vagina and the bottom of the vagina can start to actually weigh in or weigh, I can't make my hand do that, but basically the rectum can push into the vagina and the bladder can push into the vagina, causing almost like a bowing of the tissue in the vagina. And it's not that your bladder itself is coming into the vagina or the rectum itself is coming into the vagina, but they are pushing the vaginal walls in, and that can cause it to protrude out. So that when you are looking down there, the pressure you're feeling is actually the vaginal tissue moving forward or sagging down because of the weight of the bladder and the weight of the rectum, or any bowel or stool mass in the rectum. Same goes for the uterus hanging down like this, and the vagina being like this. When it starts to weigh, you can start to actually see the cervix coming forward with bearing down, or sometimes even without much effort, to the point where it can actually, like in the picture we posted, start to show from the vagina where you see the cervix sticking out. In extreme cases, that can actually happen where the entire uterus slides forward and out. It can be pushed back in, but it's definitely not one of those things that is, ideal. You don't want to be hanging around like that, no pun intended. And there are ways that you can have this corrected. But the most important thing to understand, though, is this is a natural part in the process of getting older and of having had children and various other things. But natural doesn't necessarily always mean comfortable or okay or quality lifestyle. And so you have ways that you can fix this. However, if it's not affecting you, you don't have to fix it just because you have it. So in other words, if you do start having prolapse and you are feeling pressure and you do notice that there are things that are kind of sliding forward when you've been standing on your feet for a long period of time, if it is not functionally compromising you in any manner, then you don't have to necessarily rush to have some surgical intervention done. There are cases where that's not true, and the only way to correct that is if you have a surgical intervention done to make sure either the organ that's sliding out, like the uterus, is removed, or the vaginal tissue is reinforced. And those can be involved surgeries with somewhat of a recovery time, but overall very safe, often done, and with great results. But to get back to why it happens, we talked about childbearing is usually the biggest risk factor, age and aging is a risk factor, and then if you have any other kind of chronic medical conditions that increase your abdominal pressure, primarily like coughing, or if you have like a respiratory condition, constipation and lots of bearing down can also trigger that as well. And otherwise, the ways we can treat it include doing nothing, observation, or if it's affecting your lifestyle, in other words, the lack of support on these structures is affecting how you are functioning. One of the ways that can happen is leaking of urine. When the bladder is not supported as well as it used to be because the vagina is starting to let the bladder bow in, all of its stability is compromised, and it can cause you to leak with laughing, coughing, sneezing. Or the opposite can happen where even when you are trying to pee, you're not able to because the bladder has sunken down so much that you actually have to put your hands inside the vagina and push it up in order to be able to empty your bladder, something we call splinting. And that can happen even with the rectum, where a woman her vaginal tissue is so compromised that the rectum, as it's pushing stool out, actually is able to kind of bow into the vagina, and the stool gets stuck there inside the rectum in a weird out-pocketing. And the only way that you can comfortably poop is by actually putting your fingers inside your vagina to press down on the rectum and the stool mass so that the rectum is able to push everything through. So with that being said, one of the things you can do if it is compromising is Kegel exercises. Strengthening your pelvic floor is one of the main ways to try and at least somewhat reverse, if not at least prevent any progression of the compromise in these muscles. And this is something that women should really start thinking about as soon as they are even pregnant, because doing pelvic floor strengthening exercises is really, it's one of those things that the earlier you start, the better, just like sunscreen. You don't want to wait till you're already experiencing prolapse to start reinforcing these muscles. And one of the things that you can bring up is when you are visiting your doctor after you've had a baby in your postpartum visit, bring up the conversation about, hey, what can I do to strengthen my pelvic floor and, bring things back to where they used to be? Because if you're not able to target your muscles and you need a little guidance, we can actually show you how to do it in your office visit, or we can even refer you to something called a pelvic floor physical therapist. They are fantastic, and they can actually, it's like having a coach show you exactly how to do a Kegel exercise in the best way possible. If I was to give you the quick and dirty on how to do a Kegel exercise, sit on the bathroom toilet, start peeing, and then stop. Whatever muscles you just used in order to stop your pee mid-flow or midstream, that maneuver that you just did without knowing exactly how you did it is a Kegel. And if you're effectively able to stop your urine, you are doing an effective Kegel exercise. So starting to practice that way right after you've had a baby to reinforce your muscles before they are compromised too far, especially important when you are having multiple pregnancies or if they're closely timed and your body hasn't had a full chance to recover. There are also devices out there that you can use to actually learn and get feedback that you are doing a Kegel exercise or pelvic floor strengthening exercises correctly. One of those devices I actually did a segment on, which will be coming out on Lifetime, the Lifetime channel, where it is a device that is inserted into the vagina, similar to a tampon, but much smaller. And it is actually able to connect with an app on your phone so that when you do a Kegel exercise or attempt to do a Kegel exercise, it is able to gauge the strength and frequency and if you are doing it correctly, so that now you're not just kind of sitting there being like, I think I just did one, even though I just did one and another one and another one. But you actually get that feedback so you know you're doing it correctly and you know that you're improving because it's able to track your results. And I'll list the name of this device in the comments, or you're more than welcome to watch the segment when it is released on Lifetime channel. I will let you guys know about that as well. There are other ways that you can also strengthen your pelvic floor, and I mentioned one of them being that going to the actual pelvic floor physical therapist to have a guided coaching session to learn how to use those muscles. And then if those have not been effective, or they are effective but they haven't really gotten you the results that you were hoping, one of the other non-surgical approaches that you can consider for pelvic organ prolapse, where your tissue is kind of sagging down, is something called a pessary. The best way I can describe a pessary is that it is usually a device, a medical device that is in some form or shape, either a plastic silicone substance that is created to block, or it's a space occupying device that is inserted into the vagina so that it scaffolds the tissue of the vagina from actually sagging down. In other words, you are putting something inside to prevent things from sliding out. And the way it works the best is when it is big enough to prevent things from sliding out. So very effective when it is correctly fitted to you, and that is something you have to have done in your gynecologist's office. There are various shapes, there are various sizes. They come for different purposes as well. There's even pessaries that women can use in pregnancy, and when it's appropriately fitted to you, it can be a game changer. One of the setbacks of that is that, as I mentioned before, it has to be big enough to accomplish holding, kind of holding everything up. And so that can also be within and of itself uncomfortable because you are putting that inside the vagina. The most common patients that I recommend that to are the ones who are really just not ideal surgical candidates, either because they're very old or they have multiple other medical problems and their heart may not be able to handle surgery, or someone who's just really averse to having surgery and wants to try every possible option before resorting to that option. Otherwise, you may find that having a surgical intervention to something like this is actually, over the long term, a lot more comfortable and a lot more impactful in terms of giving you the results that you're hoping for, especially if you're young, especially if you're active, and especially if you're healthy and in good shape and you can handle surgery. It is usually same-day surgery, and the recovery time is anywhere from 3 to 6 weeks, and depending on the surgery itself, and you will be able to regain that functionality that you are hoping to regain from the improvement in the pelvic floor muscles. So, to recap, pelvic organ prolapse, real deal concern. It can be very quality of life compromising, even though it's not life threatening. A lot of women don't even bring it up because it's one of those embarrassing things that nobody really talks about. Hey, are your organs sliding out of your hoo-ha? But I encourage you to have that discussion amongst yourselves, amongst your friends, amongst you and your doctor, so that you can take a more active approach in making sure that you are really, maximizing the likelihood that you are living your best life. And these conditions can be very, very compromising in that they can cause leaking of discomfort and overall, dissatisfaction your life is. And sex life as well. And there are ways that you can fix it, primarily pelvic floor strengthening exercises, considering something like a device that actually reinforces and gives you feedback when you're doing pelvic floor strengthening exercises correctly, as well as space occupying devices such as pessaries, or speaking with your gynecologist about pelvic floor reinforcing surgeries. All right, exciting new announcement. I am going to be opening up my Facebook schedule so that you guys can start scheduling virtual visits. The first appointment will be available starting May 1st, and it's just going to be the placeholding app that we use so that I can start making sure that, if anybody wants one, they have a slot secured, and then I'll be transferring it to when the telehealth app is available so that we will be contacting you for your appointments through the telehealth app once it's launched. But at least in the meantime, you can start booking and you have a spot secured. And again, the first 2 weeks of my telehealth services will be absolutely free. And then subsequently, I'll be giving you more details about the cost and what insurances I'll be able to cover, and more details about, who can be my patient and who may, need to wait a little bit longer, et cetera, et cetera. So I hope you guys have a fantastic weekend, and all the best to you guys.